Hi, I'm Susan Loynd. I'm the Director of Human Resources here at Washington County Mental Health. And with me here today is Rachel Lavallee, our Director of Nursing, or as I like to call her, Nurse Rachel. May I call you Nurse Rachel?
Absolutely. You can
Excellent.
call me
And we're here today to do a fireside chat and talk about some of the frequently asked questions that we're fielding both in HR and through nursing, through our emails here from staff. So,
Absolutely.
you ready?
We are ready.
Okay, here we go. So our first question is, folks are telling us that they've heard that a cold is sometimes caused by the coronavirus. Is this true?
It's a good question, Susan. And yes, a coronavirus is one virus in a group of many. And so many times the common cold is caused by a variation of a coronavirus. However, the COVID-19, the coronavirus 19, is a variant that's much different and causes much more significant symptoms, and we're going to put it in its own group by itself.
That's interesting. And if most people only experience mild symptoms, why is this such a big deal? Why are we having this experience here in the
Well,
middle?
it's true, and I think that's caused a lot of confusion and questions throughout the duration of this pandemic, and that the majority of people that contract coronavirus do have mild symptoms. That's true, and can be taken care of at home and will recover quite well. However, there is a percentage of people that are getting quite sick with it and dying with it, and those need to be treated in the hospital. And because of the amount of time or the spread of the coronavirus happening quickly enough, if it spreads too quickly, a lot of people are going to end up in the hospital. We will not have the capacity to take care of everyone in an ICU environment. So it would be catastrophic if we hadn't put these measures into place.
Okay, well that's a good segue into what is the current state of COVID-19 here in Vermont? What are you hearing on the daily briefings and Governor Scott? And
So we are continuing to do a really amazing job in Vermont. The leadership that we have had throughout this pandemic has been pretty fantastic. We've been recognized on a national level about the response we've had. The summer was a very nice reprieve, where we didn't have a lot of coronavirus, but as the weather got cooler, as expected, people went inside and the cases did grow in Vermont. I think a lot of us had our guards down, and the case count has continued to grow steadily since November. The holidays did put a little bit of a strain on that as well. And the number of cases we have in Vermont at this point in time are averaging, around 100 to 150 cases a day, which is about the middle of the ground as far as what they thought might happen after the holidays.
So not quite as catastrophic as they predicted, but
yeah,
also
exactly, but not as
well.
great as if everything had been in place. So.
And I'm assuming a lot of that has to do with being indoors, and we see this every winter, right? Flu and cold season, that people, when you're trapped indoors, you're more likely to pick up germs. And
Absolutely, we're closer to people, and we're not getting fresh air, and that's a common situation that occurs.
So here's a question for staff, and we get this in HR too. If I just have a sore throat or mild case of what could be a cold, can I just keep coming to work, Rachel?
So any other winter, I would probably say okay.
That was a trick question.
But you really can't this year. The coronavirus has many different symptoms. It can present differently in people.
But it could just be my allergies, or I could have a cold. Can I just wear my mask and come in?
Well, it may just be your allergies, and it may just be a cold. Hopefully that is the case, but there's a small chance that little sniffly nose or that little sore throat or just a little bit of tiredness is actually a mild case of coronavirus, and we can't risk having that spread in the workplace. So we do ask, and I know your team has been great about this in HR, that anybody who has mild symptoms is not coming into work. They're reaching out to their PCP and either waiting that out for 24 hours or so, or going out and getting a coronavirus test to just make sure that they are.
Was if not everybody gets a fever with coronavirus, why are we still kind of diligently checking people's temperatures before they're allowed to come into our buildings?
Okay.
If that's just one of many symptoms, why have we, honed in on that?
Right. So there are many symptoms, as you just pointed out, but to do screenings, we needed something tangible. So when you're walking in the door for work, you may or may not say you have a sore throat, but we can't really monitor that. So we needed that tangible piece.
Like a data point.
It's one thing that we can actually monitor.
It's like taking control of a situation.
It may not cover all of the cases, but it does cover some, and that's why we have that put into place everywhere.
Yeah. So here's a good question, and I've had this thought rattling around my brain. How come if I'm allowed to come to work, I can't hang out with my friends or family, or I'm being exposed potentially to coworkers and other people in my community when I go to the grocery store, so how come I don't get to hang out with friends or family?
I know. I mean, right now, you and I are sitting here.
Yep.
Why can't we do this at home? Well, it's a good question, and it's because in the workplace, we have all these rules in place, and people have to follow them. So, you and I are a little bit closer than 6 feet right now, but we're wearing masks, and we're being held accountable to wearing masks. When you're with your friends in your own house,
I don't hold myself accountable, just for the record.
No one holds themselves accountable. When
I need these kinds of things in place.
So, exactly. When kids are in school, they are wearing masks. They're having their hands washed regularly. They're trying to have that distance separated.
I've actually heard that workplaces and hospitals and schools are actually much safer because of that, because of all these protocols.
Exactly.
Is that accurate?
It is accurate, and most of the spread that has occurred in Vermont and elsewhere over the past month and a half is spread that occurs between family members or friends at small gatherings.
So that people kind of let their guard down is what I'm hearing you say, because you're in a home environment and you're hanging and you're eating and you're going to come within 6 feet, and people aren't as vigilant as when we're in a workplace and there's certain expectations.
Absolutely.
Yeah. Okay. So shifting gears a little bit, tell us, I'd like to ask some questions around the vaccine. So how does the actual vaccine work? Tell us a little bit about that.
So vaccines are designed to create a response from your body's immune system. So if you think about a vaccine, it's like giving training to your army. If you think of your immune system as an army that is there to fight something.
I just got the little green plastic soldiers in my head.
We'll go with that. That works. So if you do not have a vaccine for something and that virus gets into your body, your immune system is going to be caught off guard. It's like not knowing that they were in a war.
Sneak attack.
Exactly. It's like the Trojan
Somebody
horse.
come over the castle wall.
So the vaccines are there to basically train your army to say,
sort of fortify you.
If you come in contact with this, now you know what to do. You can attack it right away and prepare. So that's how vaccines really work. It's giving your body an immune system response. It's building up antibodies so that it knows how to attack if it comes into contact with it.
So tell me a little bit about, we've got these 2 different vaccines that are available, and how do they work differently than other vaccines that we may have experienced in the past?
Right. So the 2 vaccines that are currently approved for emergency use in the U.S., and both of those are being used right now in Vermont. There is the Moderna vaccine, and then there's the Pfizer vaccine. Both of these are 2-dose vaccines, and they both work similarly in that they are RNA or mRNA technology. So this is a pretty new vaccine technology. They've been working on it for quite some time, but this was a great opportunity for a lot of these companies to actually use this technology to bring these vaccines to market. So what these particular vaccines are doing is giving your body basically the blueprint for what this virus is. So some vaccines give you like a part of the vaccine that's been
and that's why people sometimes
inactivated.
have symptoms, right?
We'll talk about that.
We'll come back to that. Skipping ahead.
So no, you're good. So some vaccines give you a part of a vaccine that's been or the virus that's inactivated. Yeah. So your body says, okay, I've seen something similar to you before, and it creates a response. Yeah. Some vaccines give you a chemical copy of what that looks like.
Oh, interesting.
And these ones give you the blueprint. So it's messenger RNA, which goes into your immune system cells.
Ooh.
And your immune system cells duplicate that into basically DNA. And then your body then knows what to do if it comes in contact with the coronavirus. So it's like the Army got the other team's plan of attack ahead of time.
Yes.
Yeah.
Oh, okay. Cool. So one of the questions that comes up is we're hearing a lot in the news that there are now variants or variations on COVID-19. So that feels scary. Do these current vaccines, are they equipped to handle all these different variations?
Yep. So they believe so. And part of the great thing about the RNA technology is the blueprint is a little broad. So any small variation, your body is still going to create an immune response and be able to attack that.
Well, that's good news.
It is.
How come there's only certain people right now that are allowed to get vaccinated? Tell us a little bit about the rollout and the staging. I know we've had conversations here about phase 1A and essential workers. Can you walk us through that a little bit?
Yeah. So the way Vermont is rolling out the vaccines is they wanted to be sure that healthcare workers were absolutely the first up to get those. And so the first healthcare workers are those working in the emergency department, the ICU, EMS, Washington County mental health screeners. Yeah. Those that are walking into situations with very little preparation for being able to screen someone to see if they have COVID, maybe coming into contact with someone without COVID without knowing it. So those absolutely were the first folks to get vaccinated. Second are other healthcare workers that are patient facing. So they were able to include the majority of Washington County mental health staff that are patient facing in that group.
How many folks have been vaccinated so far here at the agency?
I think we're about 340.
That's amazing. That's great.
So 340 of our staff.
And they've had the first dose?
Have had the first dose.
And then it's 28 days for until the second dose?
Yep, so it depends on which vaccine they got. So those that work in our residential programs were vaccinated through pharmacies. The state contracted with some pharmacies to do the long-term care residentials. Those folks got the Pfizer vaccine, and that is a 3-week until the second dose. Okay. Whereas the rest of the patient-facing staff at Washington County Mental Health went to CMVC. CDMC. Oh my goodness. I need more coffee.
Hospital. That place on the hill.
To get their vaccines, and those are the Moderna vaccines, and that is a 4 weeks between the two vaccines.
Any difference in the efficacy between the two different
vaccines?
vaccines?
No, those are both right around 95, 96%.
Any difference in what people are reporting for like side effects, or do some people do better with one or the other in terms of
no. I think both have folks having side effects from just a sore arm to feeling pretty run down.
Right, we're getting back to that.
Do you want to talk about that?
No, I mean, you told me we're going to get back to it. So after the essential workers, there was a change, right? Didn't Governor Scott bump up the elderly after the essential workers?
Thank you for bringing that up, because I've had quite a few questions about that.
I mean, makes sense, right?
Yeah, so originally it was talked about that right after healthcare workers, they were going to roll out all of the essential workers that might come into contact with the most people. It makes sense. However, those are the folks that might be getting COVID but are not necessarily dying of COVID.
Gonna die, yeah.
So
Sure.
we bumped up those that are most at risk of dying of COVID. So starting the 25th of January, those that are over 75 in Vermont are eligible to go get the vaccine. And after that rolls out, it's over 70, and after that, it's over 65. And along with the group in the over 65 category, they're also adding folks that have certain medical needs that would make them more susceptible to getting pretty sick.
So like underlying
health conditions like
and so after that,
diabetes.
And then would the rest of our staff, she said selfishly as admin people and other folks, after all these folks are vaccinated, would there be another phase for people that are working in quasi healthcare but aren't?
Yeah, I'm hopeful that the next piece after that would be to bump up those that are in essential workers, like teachers and the rest of us here. So.
And is there a timeline for that? Like when do they expect to be done with the over 65 folks and moving into the next phase? Do they have they said anything?
A lot depends on the amount of vaccine that the state of Vermont actually gets.
Right.
So we're reliant upon government distribution right now. Mm-hmm. So everything's, as we know, a little in flux at the moment.
Really?
So the more we get, will determine the timeline, but they are saying that they're hoping to get through this group by end of winter, spring.
March.
So March, yeah.
And do you see anything changing with the new administration in terms of how many vaccines are coming to the state? Or I know it's get out your crystal ball, but do you think there'll be a change at all in rewriting contracts with the pharmaceutical companies? Anything different?
I'm certainly hopeful that there are going to be some newer contracts and some speeding up of production. They're going to be tapping into a couple other resources that hadn't been utilized before to try to ramp up supplies. And that's not just the amount of vaccine, that's also ramping up the supplies like syringes, because in order to administer all these, you need syringes and you need staff to have more masks. So it includes lots of supplies.
So here's a question, and I know you and I have talked about this, but once I get vaccinated, can I just take off my mask and have some fun, Nurse Rachel?
Oh, no, Susan, you can't. No fun. You can have fun with your mask on. So this is kind of ever-evolving science.
It's kind of a misconception, though, isn't it, that you can rip off your mask and go have fun?
Right. You're like, I'm vaccinated. I can do whatever I want. But the truth is, we just don't have the science and data yet to support what we should or shouldn't be doing once the vaccinations happen. So if you think about it, like I said, how vaccines work, you create a response for your body's army to be able to fight off that virus. If you have had the vaccine and you have a 95% chance that your immune system is able to do that, that's great. But that's only when that virus gets into your body. So let's say you're out and about and you pick up the virus. This is a respiratory virus, so the most common entry point is your nose. Let's say that virus starts replicating like crazy in your nose. It takes a hold and has a party. So you're not having any fun, but the virus
that's quite a visual.
Is having a party in your nose. Your immune system will start being able to fight that off as it's entering your bloodstream. But there's still maybe enough there that you could possibly be continuing to spread that virus around.
So even though I've been vaccinated, I could have this party in my nose and a viral load that if I take my mask off, I could infect somebody that hasn't been vaccinated.
Right. Now this is just a possible scenario.
Yeah.
Most scientists and doctors are hopeful that in the war against the virus, your body will win enough that there is not going to be enough of a viral load to really spread that. So,
but we can't take that chance.
But we can't take it yet.
We don't really have the data to say it's X% or...
Right. So stay tuned because we're going to have a lot more of that.
I thought you were going to say stay tuned. We're going to have a big party when we can all take our masks off.
Well, we might do that too.
All right. So the next question is, people are asking there's a fear about getting vaccinated, as you know, and we need a certain level of people to be vaccinated to have herd immunity and potentially get back to some sort of normal. And one of the things that I think people are concerned about is having symptoms. So some people have, and you touched on a little bit earlier, but some people have very mild symptoms as a result of the vaccine, and others have a little bit more significant symptoms.
Yep.
Can you talk a little bit about that?
So it's because every single one of our immune systems is different. You know, we're like snowflakes. So
snowflakes.
So it depends on how your immune system kicks in. So when we are giving your body that vaccine, you are hopefully creating an immune response. Some people's immune response may be mild and some may be greater. And so that's why there is a varying degree of symptoms that people are experiencing from getting the vaccine. In actuality, the fact that someone might get sore joints or feel kind of run down and tired, it's a good sign. It means your immune system
Your body's
is
fighting,
doing what it's supposed to do and creating the army. So
and I've also heard, and I think I've heard you say this as well, that when you get that second dose, you're likely to become sicker than the first dose.
Yeah.
So the symptoms might be a little bit more severe the second round as you're really building up that immunity. Is that
exactly
correct?
So the data does show that if you're going to develop some type of reaction or symptoms to the vaccine, or as your immune system is getting bumped up, yes, the second vaccine tends to create a slightly greater reaction than the first.
So I know you've been thoughtful as you're scheduling our employees to have them spaced out. So in the event that people do experience symptoms, we don't have, say, a whole group home getting their shots on the same day, so that if people do need to take sick time to recover, we kind of have a plan on that.
We've staggered it. So those that are in the group homes, there were actually 3 clinics set up so that it could be split half and half. And when I was scheduling folks, I was trying to make sure that I wasn't putting everybody in one program on the same day at the same time.
Which we appreciate.
Yeah.
As I'm sure our program managers in HR do. So here's your $1 million question. If you could get out your crystal ball, what do you see? When do you see this all ending? What's the meaning of life, Rachel, now? When do you see us getting it back to some sense of normalcy? I know you and I have had this conversation for a while now, and every time you answer the question, I don't like your answer, so I don't want to pressure you, but a realistic timeline of when, because I think it's helpful for people to know, like, don't sugarcoat it, but what do you think?
I know, because I hear people being like, oh yeah,
I mean, part of me says I want you to lie to me.
I'm booking a cruise in March, and I'm like, I don't think that's a good idea.
That's not happening. But I think it would be helpful just for people's mental health and be able to kind of plan what level of support might we need as employees to sort of get through the next several months.
I think most of the scientists and doctors that are working on this and have better crystal balls than I do are looking at late spring and summer as the time where hopefully there is going to be enough immunity, enough herd immunity that we can get back to some sort of normalcy. I heard Dr. Fauci say something about late summer today, but it's all based on the amount of vaccine we can get out there and the speed in which we can get folks vaccinated and the people actually going and getting vaccinated.
So, I mean, there's a lot of variables there.
There are a lot of variables, but I'm hoping we're going to have a good summer.
As are we all. And I just want to take a moment on behalf of everybody here at Washington County and really give you a profound thank you so much for all of your hard work. We would be lost without your guidance here. I know personally, as the HR person, to be able to pick up the phone or send you an email and get a response and really feel like I'm getting an informed, educated response to what is scary and challenging and emotionally a roller coaster for many of us. I have so appreciated your guidance in these really difficult times. So I just want to give you a shout out.
Thank you.
On behalf of the whole senior team and all of my colleagues and every anybody that's ever worked here. You're doing an amazing job, so
I really appreciate it.
keep up the good work.
Thanks,
Is there
Susan.
anything else that you wanted to share with folks?
No, I just want to say keep up the good work for all of you. And I know it's taxing and I know it's hard. And, you know, as I said in a recent email communication, it's a marathon. But
Not a sprint.
it's not a sprint. But, you know, we're like at mile 20, 21. So we can do it. And
Is there a party at the end? Is there water? Is there something? Is there
yeah.
confetti? Yeah,
Sure
okay.
is.
Okay.
And you know, all of us here at Washington County Mental Health are working overtime to support this community. The toll that this pandemic has taken on everybody's mental health is pretty extensive. Our work is just begun, and so.
That's true.
My gratitude goes out to everyone on our team.
I mean,
and what
all
they're
of our
doing.
employees and what they've been able to do in these trying times has just been amazing. I'm in awe of my colleagues, actually. Yeah.
Likewise.
So thank you so much for
Thank
spending
you,
some
Susan.
time with me.
This has been fun.
It's been really fun, and I hope it was informative for folks. And thanks.